Gallbladder cancer is a rare but serious form of cancer that starts in the gallbladder, a small organ located under the liver that stores bile. It is often difficult to diagnose early because it may not cause symptoms until it has advanced. Causes and risk factors. The exact cause of gallbladder cancer is not well understood, but several risk factors can increase the likelihood of developing the disease. Gallstones. Gallstones, particularly large or multiple stones, can increase the risk of gallbladder cancer. Chronic gallbladder inflammation. Conditions such as chronic cholecystitis or inflammation of the gallbladder can raise the risk. Age and gender. The risk increases with age and is more common in women than in men. Family history. The family history of gallbladder cancer or certain genetic syndromes can elevate the risk. Pre-existing conditions. Porcelain gallbladder, the condition where the gallbladder walls become calcified. Biliary tract infections, chronic infections of the bile ducts. Diet and lifestyle. High-fat diet, obesity, and smoking may contribute to increased risk. Genetic factors. Certain inherited genetic mutations or syndromes, such as Lynch syndrome or BRCA mutations, may increase risk. Symptoms. Early-stage gallbladder cancer often does not cause symptoms, but as the disease progresses, symptoms may include abdominal pain, pain in the upper right side of the abdomen, which may be persistent or intermittent, nausea and vomiting, persistent nausea and vomiting, sometimes with no apparent cause, jaundice, yellowing of the skin and eyes, which occurs when the bile ducts are blocked, unexplained weight loss, significant and unexplained weight loss, loss of appetite, a noticeable decrease in appetite, fever, persistent or intermittent fever, itching, itchy skin due to bile buildup in the blood. Diagnosis. Diagnosing gallbladder cancer typically involves several steps. Medical history and physical examination. Review of symptoms and a physical exam to check for signs of liver or gallbladder abnormalities. Imaging tests. Ultrasound, to visualize the gallbladder and detect abnormalities. CT scan, provides detailed images of the gallbladder and surrounding areas. MRI, offers detailed images and helps in evaluating the extent of cancer spread. Endoscopic retrograde cholangiopancreatography (RCT), a procedure to view and sometimes biopsy the bile ducts. Biopsy. Needle biopsy. A small sample of tissue is removed and examined under a microscope to confirm the presence of cancer cells. Laparoscopy. The minimally invasive procedure where a thin tube with a camera is inserted into the abdomen to look for cancer and obtain tissue samples. Staging. The stage of gallbladder cancer describes how far the cancer has spread. Stage 0. Cancer is confined to the inner lining of the gallbladder. Stage I. Cancer has spread to the gallbladder wall but not beyond it. Stage II. Cancer has invaded surrounding tissues or nearby organs. Stage II. Cancer has spread to nearby lymph nodes or large blood vessels. Stage IV. Cancer has spread to distant organs, such as the liver, lungs, or bones. Treatment. Treatment for gallbladder cancer depends on the stage of the disease and overall health of the patient. Surgery. Cholecystectomy, removal of the gallbladder. In early-stage cancer, this may be sufficient. Partial hepatectomy, removal of part of the liver if the cancer has spread to the liver. Extended surgery may involve removing nearby tissues or organs if the cancer has spread extensively. Radiation therapy. Uses. High-energy rays to kill cancer cells or shrink tumors, often used in conjunction with surgery or for palliative care. Chemotherapy. Uses. Drugs to kill cancer cells or stop them from growing. This may be used when surgery is not possible or if the cancer has spread. Targeted therapy. Drugs that specifically target cancer cells with certain genetic mutations or characteristics. Immunotherapy. uses the body's immune system to fight cancer cells. This is an emerging treatment and may not be widely available for all patients. Palliative care focuses on relieving symptoms and improving quality of life when the cancer is not curable. Prognosis: the prognosis for gallbladder cancer varies based on several factors, including stage of the cancer. Early-stage cancers have a better prognosis than those diagnosed at a later stage. Treatment response: how well the cancer responds to treatment can affect outcomes. Overall health: the patient's general health and ability to tolerate treatments can influence prognosis. Conclusion: gallbladder cancer is a rare but serious condition that often presents with symptoms that may be mistaken for other conditions. Early diagnosis and treatment are crucial for improving outcomes. If you have risk factors or symptoms that could indicate gallbladder cancer, seek medical evaluation for appropriate testing and treatment options.